All right. Evening, everyone. My name is Colin Agatelli from Student Doctor Network, and I'm here with Dr. Emil Chuck, the Director of Advising Services for the Health Professional Student Association, for our first Ask the Expert Live office hours of 2026. Dr. Chuck, how are you doing?
Hi, good. I hope everybody is doing well and has survived all the weird weather patterns that have been happening, certainly East Coast and so forth.
Yeah, there's more than enough to worry about these days. All right. So, for anyone watching, throw your questions in and we will get to them. But to start it off, very general. I'm applying in the 2026-2027 cycle. What generally should I be doing when?
Well, if this is the month of March, so for those of you who are going to be applying, you've got 2 months until May and 3 months until June. So the time is going to go by really, really quickly. If you haven't already started doing this, for many of you who are in school, balance whatever you can. Certainly keep doing well in school, but you probably know where you are in this whole entire process of looking forward and really setting up your application. There's a number of things that we'll certainly be talking about regarding resources that we do provide here at Student Doctor Network. If you haven't already done so and you've been working on an application, we have our pre-med application, which is sort of emulates the AMCAS application, so that you can kind of get a sense of how you would describe your activities, how you describe many of the items that you're going to be putting in working activities. And at this point, you should at least be finalizing a lot of your information to get your application together. Many of you, hopefully by now, or will be very soon, going through an institutional or committee letter process. If you are doing that, you should have probably already submitted some document saying you wanted to be interviewed or you wanted to have a committee letter very early on, maybe about a month or two ago. And so now, hopefully, you're going to be in the process of getting, I don't know, maybe some of you will have interviews, some of you will have other things that you'll have to do. But this is the time where at least your letters of recommendation need to be lined up, and you should have already gotten your commitments for who's going to be writing your letter of recommendation. I know we have had a lot of people ask, I would love to just have like 7, 8, 9, 10 people write my letters. And while I do think if you do wind up with 8, 9, 10 letters, it is a bit overkill to have all 10 letters go to every single school that you're going to be applying to. I also acknowledge the fact that a lot of professors and a lot of references are clearly going to be freaking busy. We're going to, I know from having been a professor and having been inundated with like 30, 40, 50 requests for writing a letter of recommendation on behalf of a student. It's a little overwhelming. And so if you haven't asked your professors now, they're going to just get bogged down with a lot of requests for a lot of cases if you wait later on. So have those conversations right now with all your references. Make sure all of that is lined up and ready to go. Maybe you'll have your letters ready close to the start of the application cycle. If you have a committee letter, many of those letters might be in the hands of your committee, hopefully by the end of the semester as well. Just get a good idea of how much time it's going to take your reference to write you a letter, and make sure you do have enough people writing you letters for contingency purposes if one person can't do it because they're overwhelmed or something personal has come up or who knows, whatever happens to them. So I think it's always, I will admit, it's always nice to err on the safe side of things. But for the most part, most people are going to be very nice and happy with just 4 or 5 letters of recommendation. A committee letter supersedes the need for 4 or 5 individual letters for most of the schools that are out there, medical, dental, and whatever. So just make sure you have a good idea of what's happening with your letters at this point. Many of you are, I've always been very surprised. We've been getting a lot of posts on the forums about just trying to get a sense of what are my chances with about 2 months to go. Am I missing anything very obvious? And so certainly take the chance if you haven't already. We understand, first of all, this is not your real application. You're just giving us impressions of what you think is important, what I presume you're going to be putting in your application, and we just make just a cursory judgment. It is not set in stone of what your absolute chances are, because not everything is just wired into metrics on their own. There's a whole lot, a lot of your narratives, a lot of your writing, a lot of your letters are going to also are coming into play when it comes to you getting an invitation for interview later on in the cycle. So just make sure that whatever you do, you are as well polished as you can. You get enough feedback on your work and activity section. You definitely write your secondary essays. Do a lot of that pre-work. Do a lot of the work that you need to do to know why you are going to apply to each school. And to that effort, we do have our Becoming a Student Doctor course, which is designed around secondary essays, as well as certain things and highlights that in medical and health professions education, certain programs are doing to address areas that you might not necessarily be seeing, because this is stuff that is involved in medical education for the next decade or so. But these are going to be very important for you to have a good sense of how a school works, handles challenges regarding social determinants of health, or scientific misinformation, or generative AI usage in healthcare. All of these are very nebulous and very much not solid. But these, some of the topics that are in the course, should give you a little bit of a foundation to know what to look for when you do visit schools. And I do emphasize visit schools, go to recruiting events, and you ask questions as it relates to your specific interest in attending that school. So Becoming a Student Doctor is really a primer to help you go through the process of writing for secondary essays, for interviews, and also by extension, how you would be able to craft your personal statement. As I mentioned, we do have a personal statement workshop, a free workshop coming up on March 12th. This is in collaboration with a group of other people with regards to the Social Mission Alliance, and I believe the Relate Lab. They've organized a separate sort of program, free program for applicants called Healthcare Stories. And the point of that website is to really help applicants talk about their narrative, especially as it relates to addressing social medicine and sort of health equity. So all of these, we've already held one workshop before. We're going to hold another one on March 12th. It'll be a masterclass session, so we will not have recordings posted on the internet. You are also not allowed to record the sessions yourselves, because we're using people's drafts. And I think it's really, we need to honor the fact that people are still working on things. And so we're going to do whatever we can to maintain confidentiality and make sure that the people who have volunteered their drafts are, get the benefit of participation and not have to worry about sharing information that could otherwise be lifted and used in somebody else's essays. And we just don't want that happening. So please take advantage of that opportunity to learn a little bit more about other people's personal statements, essays. And if you do have your own questions, we do have Ask an Expert. So I will do personal one-on-one calls, as it were, if you were interested in scheduling them, whatever is available. And if you do have your personal statement, I'll ask you to upload a copy of your personal statement and go over a little bit of what you've been doing. I'll give you a little bit of feedback, but I'll probably wind up wanting to do more in-depth editing a little bit more offline, because I don't think it's ever useful to talk to people about their writing. I usually like to just have a better chance to read over it and just see a bit of how you really think when it comes to writing your essays and so forth. If you need feedback for writing your secondary essays or doing interview prep, you do need to register and be enrolled in Becoming a Student Doctor to take full advantage of any resource that I can give you regarding secondary essay prompts. Otherwise, I know there's a lot that's out there in the internet as well, but for sure, if you really do want to take advantage of more expertise that I can bring, especially for your secondaries and so forth, please do that. A number of students that have previously enrolled in Becoming a Student Doctor have done very well in the application process. Few of them have even gotten full tuition scholarships. And so it's something that I think has been shown to have a lot of value. It's gained a lot of attention from people on the education side who are trying to find out how they can cover some of the topics that in today's climate, politically, and in higher education, there's a lot less of encouragement for individuals to learn as part of a formal curriculum. So becoming a student doctor is sort of a nice way to really get the gaps filled that are being created wherever you wind up going to medical school. So please don't be afraid of doing that too. So there's a number of different things. Whatever you are, whether it's a few months before you start medical school and you're going to start looking for apartments, you're going to start looking for roommates, you're going to start looking to see if you need a car, and you're going to certainly be looking for how to fill the gaps with regards to your financial aid packages, all the way up to, if you're going to be applying this May and June, does your school want you to take Casper or Preview? When are you going to take that? Are you going to take the MCAT or the DAT or whatever your other exam? How does that fit around there? Even by surprise, if you're going to be taking a recorded video interview, which is not Casper, not Preview, the industry leader is Kira Talent. We have an article regarding recorded video interviews. Please give yourself a chance to read through some of the articles that we've been posting over the years to really understand what the current landscape of applying to medical school is all about. This brings up. Yeah, go ahead.
I was going to say there is, more than enough things that students have to think about. It's a daunting process, that's for sure. But one question that's super, I'm not going to ruin the answer. How important is mission fit?
Okay, so mission fit is extremely important. There's an article that we wrote about how mission fit really is the key to your success. Mission fit should define what schools you choose, and it should give you an idea of what you expect of yourself once you go to a particular school. The model of holistic review is really focused and centered on mission alignment now. And so, who gets first dibs at an offer really points to one's mission fit over one's stats. And it's hard for people to understand that until you see all these videos that are on the internet just basically saying, I got a 3.9, 525, and I never got into any of my schools, and I don't know why. Probably there's a problem with your mission fit. And even though your stats are fantastic and outstanding, if you don't show why you would be a fantastic applicant, or not a fantastic applicant, but a fantastic student at that school that people would love to learn with, you're just not going to be as successful as you want to be. So I think it's extremely important, and that's something that every medical school, every health professions program is really, encouraged now, very strongly encouraged to adhere to and pay attention to.
Yeah, absolutely. I can speak to personal experience. Everything that went well for me as an applicant for this last cycle was related to one, post or what are my chances thread. Every interview I got was schools that were recommended to me that I probably wouldn't have thought of, and really dialing in on, all right, how do I fit into what they're doing here? The importance can't be understated. Any questions you guys have, please drop them in the comments. And here's a fun one. If I'm entering school in 2026, what should I be thinking about now? That's a long list.
Yeah, I think I covered a lot of it already. So, you probably already have your list from your schools. You probably have been waiting very, very patiently for financial aid to show up. Many of you are probably scheduling your visits to various campuses on second look weekends. We have an article about what you should be looking for and maybe even asking at these second look weekends as well. So we even have an article about how to survive your first year of medical school that was published last year around this time. So go look at the SDN articles, and you can probably see a lot of wisdom that's been passed down over many, many, many years. They can give you a little bit of insight of how to do well in medical school. I think even on the forums, I think a number of the experts have posted about, the transition to being a successful student in medical school, what you should do. So give yourself a chance to, if you even have to ask the experts, we'll find our articles and we'll link them to you so you can read it yourself. And it's very important that you understand it's only the beginning, and it'll be a lot of fun, but it's going to be a lot of work.
Yeah, that's what all my friends told me. Like, congrats, now you get to actually start doing work. All right. It's heartwarming. Anyway.
Hey, it is. It is what it is.
Yeah, it's going to be a job, it's work. So first off, what is a second look weekend? I don't think I've ever even heard of those. And what should I look for in second look weekends?
So for most of you who have applied to medical school, your experience probably up to this point before you got an offer has been most likely virtual, because you've had virtual recruitment events. Maybe you've gone on campus if you're local, but your interviews for the most part have been virtual. So therefore, Second Look is an opportunity for the school to market itself and give you a chance to sort of roam around the school, meet other likely classmates of yours, and meet some of the professors, some of the deans that are going to be your guides, your mentors, your people who are going to be your advocates during your period of time when you're in medical school. So basically, I mean, it really depends on what is important to you, but for the most part, I think it's a vibe check. It's just making sure you really understand, why students who are currently there are going to meet, what they really enjoy about the school, what things they will advise you to pay attention to in terms of making your experience at the school better. And just give yourself a chance, knowing that, if this is a school that you are likely going to attend, make sure that you are happy with it. If you bring family, which many Second Look weekends will allow family to come with you, or significant partners and so forth, just do it. You just want to get a sense of, you're going to be happy there for at least the next two-ish years, since many third and fourth year in medical school and third and fourth year, you're on rotations at various places. I know for sure for dental school, Second Look weekends are extremely important. For dental school interviews, though, a lot of them have been more in person, so you've already visited the campus before. So a Second Look weekend, if a dental school offers it, gives you just another shot, another opportunity to look at the dental clinic, look at how everything is organized, perhaps even get a good sense of patient management, all those sorts of things that I think are really, really important. So it's just your opportunity to give yourself, before orientation anyway, a chance to kind of make sure you know what it's like to be a student there, to travel there from an apartment or from wherever you wind up living, what the local restaurants are like, those sorts of things. So similar to what you did when you were checking out college campuses when you were a high school senior or junior, maybe some of you.
Okay, so it's kind of like it's an open house, you could say?
Yeah, it's an open house, but much more specific, yeah.
Okay, that makes sense. All right. So again, any questions you guys have, drop them in the comments, please. When should I start pre-writing my secondaries? Yeah, this one, don't do what I did, guys. Write them early.
So, I mean, if you haven't started, the matter of the fact is this: for most of you who are applying to medical school, I think a large chunk of the secondary essay prompts don't change, or if they change, it's very slight, or there's some slight modifications, certainly since COVID. So if you haven't already started, and when I say already started, I mean like even fall semester, this is about as good a time as any to start. So just do it in terms of really understanding what the questions are like, finding what you feel most comfortable talking about, and really sitting with the questions where each school will ask you, why are you interested in our school? If you don't do that, I mean, you really want to make sure that it's worth your while sending money to a particular program throughout this process. You definitely don't want to be late with submitting your secondary essays. I mean, if you pre-write the essays very early on, you should be able to turn around the secondaries like within a week of you receiving the secondary essay prompt, because hopefully you've worked on it enough. You don't need to be working on it throughout the month of July unless you apply to Duke, and because Duke is very famous for changing their prompts every single year. So if you are applying to Duke, make sure you've already pre-written as much of your other essays as you can. But aside from that, it's not, if you've done all your homework and you've front-loaded all the work during this time period before you submit your application, you're going to be in a pretty good spot. So just kind of understand that ahead of time and really know what you're doing when it comes to the essay prompts that are there, And the hardest part about this process isn't just the secondary essay writing that you're going to be doing. It's just getting all the information into all these various portals. The getting used to typing in all the information to AMCAS, including your course entry, is really tedious. And of course, you're in many cases, you're going to be asked to either do the same or going to confirm a similar directory information into the portals that have your secondary essays embedded in it. So just understand it's going to take time. And the more you work on it now, the easier it's going to be that you're not going to scramble and, quote, worry about being late once July and August come around. So it's better to do your homework early in this case.
Yeah, I can speak from experience. You're better off if you do it early. It can work out if you don't, but save yourself the trouble. What should I do if I need to reapply?
All right, so there's a number of different things about reapplying. First, I'm going to assume you had no luck getting interviews. If that's the case, you can check and see if any of the schools that you applied to offer some sort of a webinar or at least some general information session to reapplicants. I understand it may not be very, informative if you've got no interviews and you're just hearing from other people, rewrite your essays, do better on your MCAT, do better on your classes, or get more hours. That's generally what we will always tell people to do. Other things that you have to pay attention to if you need to reapply. We've had so many people talk about, I need to reapply again because I submitted all my secondaries in October. I think you probably learned your lesson. So show us you learned your lesson and don't make that mistake again. So I think you have to really, come to terms with yourself, look yourself very closely in the mirror and how you behave during the whole entire application process when it comes to submitting information back. Did you do enough homework? Did you pre-write your secondaries? The nice part about reapplying is if you wrote all your secondaries during the process and it pushed you to be late, guess what? You just pre-wrote all your secondaries for a reapplication. You just need to look at everything all over again, tighten some things up as you need to. But the most important part is you likely need to rewrite your primary application. And I think to every person who have been my peers in admissions, we all generally agree you must do a significant rewrite of your personal statement. And you got to learn to let go of your old personal statement in order for you to do that. And so allow yourself the appropriate short time period for grieving, but you need to get on it. And you need to just write a new personal statement, get some people a small group of people who you trust, including your references, to go over your application materials and make sure you really hit the mission fit for the schools that you're applying to. A lot of times people just apply to, they just overshoot because they, quote, want to shoot their shot at brand name schools and they wind up with zero. So basically make sure you really keep that in mind. I will also tell people, please, whatever you do, if you are a reapplicant, you need to consider, for medical school applicants, you must consider DO schools. If you don't consider DO schools and you bagel again, you're going to be a 3-time reapplicant. And I will certainly tell you there's many schools that start really avoiding people who are 3-time reapplicants. They won't necessarily say it on paper or anything else like that, but that's definitely something to pay attention and to keep in mind. There are a few schools that actually do outright say, we will not consider you if you are a 3-time reapplicant or more. So please pay attention to that and make sure that you plan accordingly. For any of the other health professions programs, I would hope that most of the dental, pharmacy, any other health professions programs, if you didn't do well, I hope that you would just be able to reach out to the admissions teams and see if they would be able to give you a little bit of feedback for a reapplication. Hopefully you get far with what's going on with that. But that's pretty much the best that I can ask you to do, is make sure that throughout the entire year, you've been building your experiences and clinical experiences and community service, non-clinical community service, those hours that you have anticipated, which didn't really count last year. When you submit your application, it will count this year, provided that you did them. And hopefully that will improve your profile just as well. So it's a lot.
Yeah, a lot. That's a very good way to put it. So these are all really fun questions. Maybe fun's not the right word, but what do I need to know about financial aid changes?
Well, so first of all, we at Student Network have written a number of different articles about the changes in financial aid loan caps, as well as repayment plans since the One Big Beautiful Bill was signed back on July 4th of last year. We're actually at a phase right now that we are waiting for some last minute regulations to be approved and likely to be implemented by June of this year. So for those of us who are, especially any one of us who are in financial aid, maybe if you haven't heard anything back, part of it is because the implementation rules that Department of Education is putting in, it really will make a difference in how schools will need to behave when it comes to offering you appropriate amounts of money for your financial aid package. So there's still some rules that need to still be ironed out. But for the most part, what you know is now what everybody else knows. You have now a limit for how much you can have subsidized loans for, federal subsidized loans for, when it comes to your graduate education. If you're in a professional program, the caps are certainly a lot higher. I think up to $50,000 a year. Total cumulative professional school debt is $200,000, and so forth from there. We've written it all up, all on on the website in various articles, and I'm very sure many of the schools or the major professional associations will have various webinars, and the schools themselves will talk to you about all the things that are changing with regards to student loans and the ramifications for it. We will have a future Ask the Expert webinar that will be broadcast to you, where we've actually talked to some student loan managers and our collaboration with Juno, which is a student loan negotiating sort of collective group, about what, given certain situations that I know many people who come across this webinar are looking for with regards to student loans and how to manage student loans, especially if you're looking at post-bac programs and ultimately want to go into a graduate program. How do these situations change your calculus? Hopefully we'll address it a little bit with the webinar that we will have coming up, that we will hopefully broadcast to you guys, and you'll be able to sort of see what's there. So it's a lot. We have a lot of stuff going on.
Yeah, it's a lot is a pretty good way to sum up everything right now. So Dr. Chuck, any last parting kind of thoughts or I guess you could say wisdom with respect to this process, other than just don't give up and be realistic?
I think the hardest part is being adaptable and just be prepared to just go with any change that really happens. Like, for example, we heard that one of the essay prompts for the Texas application, TMD-SAS, the character limits have changed. And so if you want to know more details, we have it posted on our forums. But you just have to understand the process is what it is. And you just, again, adaptability is an important piece of this whole entire process in order for you to really kind of go forward with it. However, that being said, if there's any advice that I can try to give you try not to take in the neuroticism way too much. And I know that's hard to say if you're just starting out in this process. Do not try to make sense of this whole process. I think that's what I think is the one thing that most pre-meds really have challenges with is we want everything to make sense. We want everything to be logical, everything to be causative, that if you have a certain set of hours, a certain GPA, a certain MCAT score or DAT, that you should get a certain calculated probability of getting in a medical school. It really doesn't work that way, even though we try to fake it that way. It really is about your mission fit. It's really about your dedication and the depth of your experience. We'll talk a little bit more about that in the personal statement workshop, by the way. But please be as involved as you can, help each other as you can. If we have our applicant experience survey, for those of you who are going to be starting in May or June or July, congratulations to you. We want to hear about how the process went for you, especially this year. So we want to hear from you no matter what happens. So.
All right, sounds good. I didn't know there were programs starting in May. Like, I thought June was bad enough. So,
well, there are some graduate, some of the other health professional programs like physician assistant, physical therapy. A lot of those actually are those will start in May and June. So I know many people were like wondering with the loan caps being effective in July. There are some programs that didn't have to worry about it because they already had to start in late spring. So, but we're trying to keep our eyes out on all of the health professions programs that have decided they would, quote, announce a shift of their start dates to before July 1st. And we're trying to keep a record of that on our forums as well. So wish us luck.
All right. Well, hey, Dr. Chuck, thank you for your time. Thank you to everybody who catches this. And if you want to put your questions in the YouTube comments, just hop on the Student Doctor Network forums. There's a lot of people with a lot of very good information. I can attest to me not completely falling on my face during this whole thing was solely due to the feedback I got from the forums. That is a very factual statement. So again, Dr. Chuck, thank you. And we'll catch you guys on the next one. Everyone have a good one.
Sounds good. Take care.